We are going to be looking at wellness through the lens of cities, communities, and investment. How do we design environments where well-being becomes part of daily life, where recovery, movement, belonging, and purpose are built into the way that people live? And so, to talk to us about all of this and so much more, I'm excited to now welcome to the stage His Excellency Maher Al Kaabi, advisor to Group Chairman and Independent Board Member at Al Sirkal Group of Companies, UAE Circular Economy Committee member, and UAE International Investors Council member. Welcome, Your Excellency. It's wonderful to have you. Ahmed Abdul Karim Al Uraj, Chairman and CEO of Saudi Health Tourism Association. Welcome. Khalid Al Mawlawi, Director General at Aspetar. Welcome to you, Khalid. And to lead the conversation, please welcome Jada Shukri, producer at Forbes Middle East. Welcome to you all.
Hello. Hi. Welcome to day two. It is sunny, it is exciting, and we're going to talk about something that is kind of a universal truth. We're talking about how healthier economies and healthier communities are gonna build stronger cities. So, with the rise of wellness driven cities, we're looking at merging everything. We're looking at merging sports, technology, and healthcare. And with us today are people who are going to talk about what investments and what we need to do for purpose built urban environments. We're going to reimagine the future, and it's going to be much, much healthier. Now, I want to start off with Your Excellency. I want to ask, the UAE is obviously prioritizing a circular economy principle. How do we turn this into something that creates a long-term value for both patients and healthcare systems, especially when we're looking to incorporate a lot of AI and technology into the supply chain?
Sure. Let me just define quickly what circular economy means so we're all on the same platform. Basically, ensuring that whatever products that we produce from design perspective, they're used a number of times in the economy. So we reduce the wastage of resources we have. And those resources we have today in the economy, how can we repurpose them when their life cycle is over? Why? Because we want to conserve the resources we have. Second, production of resources along the supply chain emit a lot of emission. And this is where circularity comes. So given that we understand now this, that means as the population grow, we require to build more cities. And World Bank says that about 2.5 billion people will be moving into cities by 2050. You're talking about quite a lot of cities going to be built. That means a lot of emission, you require a lot of hospital, a lot of clinics, and so forth. So building hospitals, how do we make sure that they are circular in nature? Making sure that the hospitals are built using reusable material which are friendly, environmentally friendly. So the carbon embedded, which is over there, are reduced as much as possible. The other important part of the hospital itself is the heating, because cities today are responsible of 80% of the CO2 emission, greenhouse gas emission. And because of the buildings, which has either heating and cooling, and hospital requires both, by the way, because of cooling of the medication which is there and the instrument with there, and sometimes require heating if you're in cold countries, but then cooling in the hot weather as well. So how do you reduce the impact over there? One, you probably could use renewable resources, energy to use these chiller system, or you use additive to reduce the impact of CO2, which something happens that we have available in the UAE, and as a company, as a group, we sell them and we provide the solution. Then it happens about the equipment you use. When you bring those robotics in the clinics, they are available in the hospitals. Many of these are actually very expensive to build and have a lot of CO2 emission happening on the supply chain. Can you actually get them refurbished because they're expensive in nature, so you can actually extend their life? Coming from technology perspective, when I talk about AI and so forth and admin of technology, today any new technology when it comes, it's important for you to know how do you get the software upgrade happening so you can extend the life of these arms as well. I could go on this a little bit, but I'm gonna allow you for more questions to be asked for the other panelists.
Now, one of the very interesting things about Aspetar is that it is still in the healthcare sphere, but it's very much focused on sports and making sure that we enhance the performance of athletes. Now, when cities integrate sports and just wellness, preventative healthcare, how are we planning to create environments that really foster long-term health, not just something that's short-term, and how do we make sure that we engage the communities?
Well, and I totally, I believe that having an advanced sports infrastructure alongside with a wellness facility, it would definitely support having a stronger community and a healthier people. And this is would support also increasing the GDP of the country and supporting the tourism and also attracting investors from abroad. And to support this argument and this theory, I would take really Qatar as a showcase for this. Qatar has built a very unique sports ecosystem where you will see that the sports stadium, the sports venues, the research entity, rehab institute, all sat at one hub. And at the center of this hub, you'll find Spitar. It's the first sports medicine hospital in this region, and Spitar also considered as one of the top global leader when it comes to sports medicine and orthopedic. And to be honest, I think that what demonstrates Spitar's success in this area is that investing in two things: the sports performance and also in the wellness infrastructure. And this is helped Spitar to tick the box of those three objectives. We did uplift the community healthy lifestyle, and they became more healthier. We also supported our economics by increasing the tourism. Spitar being recognized internationally as one of the top leader world-class services can be provided to the elite athletes and celebrities, and also by attracting some investors from abroad. You know, we did develop through our research department a few unique products that we found it very interesting to be engaged with a few investors from abroad, and they wanted to come to cooperate and engage with us to take these products into a commercialization phase.
Absolutely. Qatar has made massive strides, and Saudi Arabia is not far behind. You're really positioning yourself as a global hub for health and wellness. What are the key initiatives or partnerships that are helping drive this vision, and how is the kingdom really just appealing to international patients and investors?
First of all, I want to thank you for this actual invitation, and also I want to thank Forbes team for the nice organizing for this event, which is actually first time I attend.
Hopefully not the last.
Yeah, in the open, but also I was actually not prepared on the clothes with the heat actually. So regarding Saudi Arabia, we are not only developing the health tourism, we are redefining the concept of health tourism. We are building right now an ecosystem where we bring together the wellness and healthcare and innovation and the human experience to come together. So under the Vision 2030, it's helped a lot to guide the country in different sectors. And one of the most important sectors is the tourism. For example, our goals in 2030 was reaching 100 million visitors per year. We already achieved this number before 2030 last year. So we increased actually the challenge to 150 visitors by 2030. So this is actually give us with our wellness economy is already close to $20 billion, which is actually as a medical and wellness, we spend around 56 billion dollar in the healthcare sector too. We're talking about a huge investment happening in the infrastructure. We spend around $500 billion in the giga projects in the wellness and tourism giga projects. We are also complete this with a very good and important world-class airports. It is not about infrastructure and building, but also with connecting the world to Saudi Arabia. So we have different kind of airports, which is moving yearly 100 million passengers.
It's making the destination more accessible. I definitely agree that the economic element is a big, big player. I'm curious, Your Excellency, in the UAE, what is the most impactful economic or regulatory enablers that are really supporting the growth, even as we face, increased pressure on our healthcare systems?
Sure. I think the creation of regulatory sandboxes quite help a lot. Meaning, whenever you want to test a regulation, you test them in a regulatory sandbox before you make them a mainstream for companies to use. If you realize, roughly 20 years ago, there were a lot of sandboxes unveiled. I mean, like a few years ago, there was something to do with blockchain and AI and so forth. That's why you'll see a lot of companies are coming in over here and trying to test their ideas over here because the government is very open for those ideas. Because they say, okay, come and test it, try to see whether this is going to be workable or not. Similarly, for the health industry as well, when you have clinical trials out there, usually it takes a very long time before it gets approved, whether it's machines to be used, like if it's a robotic arm to be used for the operation, or if it's a doctor, they're trying something, a new drugs and so forth. These take a very long time. Now, if you can have that center of excellence over here, along with the regulation, then you'll be able to do things faster. That's why some of the biotech companies, which are based now in US and Canada, over the last 1 year, were able to come and move their business over here because they're not able to take the approval from their FDA respective authorities over there because the government over here has created that regulatory lab where people can test and people are able to put their ideas very quickly. So that speed is very, very important to make sure. Second, you need to make sure that you connect all the government departments together to get the data because nothing without data can work because you want to make sure what's happening because if you want to increase tourism, you want to make sure how many tourists are coming in, whether they're coming in only for tourism perspective or they're coming in also from the wellness perspective or treatment perspective. So you need to have data. You need to make sure they're connected with the clinic, with the hospitals, with the people who are issuing visas so you make the entire journey simpler. You can add another important things to it, which is analytics part, but then you can say, how can I predict for future how many people coming in for us? Now, you did one treatment or you did one preventive things. How can I even provide you something for the future so you can come back to the region here again where I can actually send you the information where you can come back. Of course, there are many other things you can do in terms of cross-border insurances, cross-border data, where you can actually get pre-assessed before coming in over here. That will all be enablers.
Yeah, definitely getting the health records being something universal that can travel everywhere. This would be a big step forward. And I'm curious, with the modernization of the healthcare systems and all these new practices that are being put in place, how is Saudi Arabia really seeing new investment opportunities, and what unique areas have really just challenged the system?
Actually, we think as a medical tourism and the new areas, we invest a lot in the technology. And the technology, we think it is the most important sector where we should focus on. So in that sector, we invest in different apps where they make the experience of the medical tourism go very smooth. For example, we have the virtual hospital. The virtual hospital connected 220 hospitals together, serving 100,000 of people as a virtual services. We have different apps right now helping together to make taking the appointments and doing the whole journey by صحتي or موعدي or وصفتي, all those integrated together. So the patient and the visitors, he can get all this consultation online. This is actually taking us a little bit from where and when, which is the numbers of what actually these apps are having right now. It's really first time having in the region.
This is wonderful. And now shifting gears back again to sports and sports medicine, how is creating this infrastructure and this like elite wellness facility really supporting the community and supporting the broader tourism and investment goals for Aspetar?
Well, let me reverse the question a little bit to see how it's an important really to address this through the urban planning of any city that you want to do, because I think those goes, hand by hand, support each other. And I personally believe that integrating the sports, the well-being and the health prevention system into any city urban planning is a vital, it's an important. And I believe this is an investment in a human people performance. It's an investment in community well-being, and also it's an investment to get the return from the economic increase for the long term. And I believe that the future city really has to be built in a way and to be developed in order to prevent people from getting illness and sick, and instead of treating people from getting illness instead. And this can be easily done by providing a space for people to exercise, to perform, parks, and also a space to cooperate with a top entity to treat people and to heal people within this city.
Absolutely. Now, to wrap up this conversation really briefly, I would like you all to chime in on what collaborative approaches you think could really just attract tourism and really maximize health outcomes. Your Excellency?
I think I'll try to give an unorthodox example first of all, before that. And I think, first of all, we need to make sure the health is going back to be educated in the education system. We need to make sure that it's there in the schools, in the university. I don't want to be sick before I'm going to treat someone, right? I need to make sure I start from home. And we try to act and preach whatever we say over here. So we need to go start these things in the schools themselves, in the universities. We need to make the health a part of our lifestyles. We should think of eliminating hospitals because we're going to live healthier, inshallah, in the future. So I'm not looking to increase the hospitals. That's one. Second, if we want to really succeed and make this region a hub of wellness, then I think we need to collaborate together. Every country in the GCC actually bring a unique value of what they can offer. So if we can open cross-border transaction with us, will be important. Third point, which is even ultimately more important, something we have tested and tried, and we're trying it now in the wellness, and we tried it in some other sectors, which is related to renewable energy, the solar panel. Today, we have something called Master City, and some of you probably are aware of it. It has started in 2006. This city actually produces solar panels. They are working in projects across the globe in 40 countries where we actually export renewable energies to them. We can do the same thing over here through research and development, meaning what? We need to attract those academians who are there in top university today and bring them over here. We did exactly the same thing for the renewable energy. So we need to bring the talent over here and train our people with that.
Absolutely. It always starts with the people. Your Excellency, Mr. Khali?
Yeah, and I would totally agree with His Excellency, what he brought into our attention here. That I think it's very important that really we do emphasize the importance of preventing people from getting illness. And it would not be possible to be happen if we really don't educate people, in the best way to do this and to make the sports into a healthy lifestyle part of our daily routine.
Absolutely.
I think it's got to complete what my actually colleague said. All this actually need a good partnership between the governments and the healthcare providers and the investors to really provide the wellness-driven cities. And I think the integration between the GCC countries is something very important in this time. We understand we have centers of excellencies in different countries, and this integration is the future and will be leading, the area will be leading the world in the health tourism in the future.
If I may borrow something, I know the time is over, but I'd like to borrow to what he mentioned, exactly all the GCC countries are doing. We heard about the urban planning of Dubai 2040, which is making sure all cities people are able to commute within 6 to 8 minutes, 15 minutes. This makes people move a lot, which is easier. I know sometimes it's very hot, but the entire city for 92 kilometers getting worked out to be completely indoor, but people can go across. And this proximity and walking will help a lot for our wellness as well, apart from the education.
Absolutely. I think we just need to stop being patients. We need to be better receivers of care and just really embody the wellness ideology in our day-to-day lives. Thank you so much to our amazing audience. Thanks you much to our amazing panelists. It's been lovely to have you.
Thank you.
Thank you.